Hello, and thank you for viewing this recording of a Seizure Smart Training from the Epilepsy Foundation of Minnesota. The goal of this training is to provide important information about epilepsy and seizures to the general community. Let's get started by looking closer at the objectives for this training. First, we want to define epilepsy and seizures. We want to identify the 4 leading types of seizures. We want to learn the appropriate response to help somebody who's having a seizure, and we want to increase your knowledge of available treatment options. So what is epilepsy? Epilepsy is a neurological condition characterized by unprovoked, recurrent seizures. So the key words in this definition are unprovoked, meaning there is not a corresponding event or factor that is causing the seizure to occur, happens randomly, and recurrent, meaning that seizure will happen more than once. So they happen often or intermittent or something just more than one time. You may also hear epilepsy referred to as a seizure disorder or seizure condition, and that is just based on personal preference of the person who has epilepsy or potentially even their doctor who chooses to refer to it in these different terms. They're interchangeable and up to the individual as well. So some key epilepsy facts. Epilepsy is not contagious. You can't catch it from somebody else. You won't start having a seizure if you're helping somebody with their own seizure. Epilepsy is not a mental illness like ADD or anxiety or depression. Sometimes it may appear as someone is having cognitive issues because of a seizure or because of side effects from medication, but epilepsy itself is not a mental illness. And third, epilepsy exists on a spectrum. Some people may have very good control over their seizures. Some people may not find good control over their seizures. And the word control means something different for every person. So it could be very simplified and they take one medication for the rest of their lives and won't have another seizure. And some people might never find good control over their seizures with their treatments, and they could have multiple or many seizures during the day as well. So it's very individualized for each person. And lastly, people rarely die from having a seizure. It is, though, dangerous to have epilepsy and seizures, but if they are managed well with good treatment and there are good people around them that know how to help them during a seizure, it is very rare for someone to die from having a seizure. So the current prevalence of epilepsy it's always very important to know that 1 in 26 people will develop epilepsy at some point in their lives. And it can really be at some point. You can be born with epilepsy. You can develop it when you're 5 days old or 5 months old, 5 years old, 15 years old, 30, 40, 70, 80, 90. It can really be at any point in somebody's lives without them showing any signs that they may develop it in the future as well. So when we think about the United States of America, about 1.2% of the population live with epilepsy. So you can see from our graphic on the right, the different shades of blue are based on how prevalent or how many people in that state live with epilepsy, and it tracks really closely to population. So just the darker blue states are the states that have more people in it. So there's going to be more people with epilepsy living in that state. But more specifically, there's almost 500,000 children in the United States who live with epilepsy and nearly 1 million people over the age of 55. So it is skewed a little bit stronger to the two ends of the age spectrum. But like I said, you can develop epilepsy as an adult or live with epilepsy your entire life as well. So it can impact any age of person around you. It's estimated that about 50 million people in the world live with epilepsy as well. So even if you don't know somebody right now who lives with epilepsy, there's a really good chance that sometime in the future you will meet someone who lives with epilepsy or has seizures, and all of this information that you're learning today will be really important to know because you'll be able to help this person with any seizures or make them feel comfortable living with their epilepsy. So demographics and statistics. Epilepsy is the fourth most common neurological condition behind Parkinson's and Alzheimer's and migraines. And though twice as many people have epilepsy as the number of people combined who live with cerebral palsy, muscular dystrophy, multiple sclerosis, and cystic fibrosis. So it really is more common than what people think of, and it's more common than some of these other more well-known medical conditions that people live with. And though anybody can develop epilepsy anytime and at any age, their demographics and where they live can add additional challenges to living with epilepsy. There are about 375,000 people who identify as Black American who live with epilepsy, 255,000 people who identify as being Asian American, and 400,000 people who identify as being Hispanic American. So it can really affect all cultures and races equally, but within those, access to healthcare, access to good paying jobs, and more can really impact how well somebody can live with epilepsy or how they can treat their seizures. So it is really dependent on different factors as well, and it's really individual for each person. When we think of the leading causes of epilepsy, it's really important to note that 50 to 60% of the people with epilepsy, there's no known cause for why they developed epilepsy in the first place. So there's still a lot of mystery involved with why someone develops epilepsy. But in the cases that we do know a cause, the leading cause is something that has damaged the brain. So from a head injury or a stroke, brain infections, or the brain didn't develop correctly as you're growing up, a brain lesion, those can all lead to a diagnosis of epilepsy. Epilepsy can have a genetic component as well, that there may be a mutated strand in the DNA that causes a specific syndrome of epilepsy. But like I said before, in most cases, over half, the cause is unknown of why this person has developed epilepsy. So there's still a lot to learn within the brain in regards to epilepsy. So what is a seizure itself? Seizures are sudden and they involve brief, uncontrolled electrical activity in the brain. So if something has happened to either create a malfunction or a crash or an overload or something like that of the electrical activity in the brain. And now seizures can occur with other conditions like a high fever or an infection or drug or alcohol use. While 1 in 26 people will develop epilepsy at some point in their lives, 1 in 10 people will have a seizure at some point in their lives too. So whether that is from epilepsy or from one of these other conditions, it's more likely that someone will have a seizure than will develop epilepsy. So it's really important to know about seizures as well and how to help people. So seizures can be very different depending on what part of the brain is involved. So you can see our brain in the graphic here lighting up the different parts of the brain. Some seizures might just occur in one small section of the brain, and some might take over the entire brain and cause a loss of consciousness as well. So there are lots of different types of seizures that we'll talk about next. So potential seizure triggers. So I think every person is very familiar with photosensitivity or flashing lights as a potential seizure trigger because you see it in movies or commercials or video games too. but it is actually pretty rare for that to be a trigger for someone's seizures. So the number one reason that a seizure might happen is because of missed or late medication. So it is very important to have really good medication adherence, so taking them exactly on time as prescribed by your care team and your doctors, and not missing any doses as well. Stress and anxiety can play a big role in someone living with epilepsy and having good seizure control, so they want to make sure that they are not working too hard or controlling the aspects of their lives that they can control to help reduce anxiety or stress. Lack of sleep or fatigue can be another seizure trigger, so it's very important to consistently go to bed at the same time and wake up at the same time and get consistent sleep throughout the night as well. Hormonal changes can be a seizure trigger. So some children might develop epilepsy as they're going through puberty, but also during a menstrual cycle, women might see increased seizure activity as well. Alcohol or recreational drug use can trigger seizures. How different drugs you take and how they interact with your epilepsy medication could be a potential seizure trigger. So care teams are always evaluating what other drugs you might be taking to make sure that they're interacting safely together. And then it's really important to live a healthy lifestyle. So making sure that you are not overheating, that you are getting enough water to drink, you're not becoming dehydrated, that you are eating healthy meals too. So, and not just eating healthy meals, but not skipping meals. Having that consistent amount of nutrition and food in you can help just level out any brain activity that might trigger seizures. Then finally, the photosensitivity as well, that can impact some people with seizures. Now, it's important to note with all of these, some people might be able to pinpoint a certain seizure trigger for their seizures that bring about seizures. Some people will have seizures that there's no reason why they happen. They can't point to anything that they missed a medication, or they had an unhealthy meal, or they didn't sleep well last night. The seizure just might happen, and they can't control it by controlling different seizure triggers. So seizure types, there are actually over 40 different types of seizures that could happen to those living with epilepsy. And so the main ways to tell what type of seizure someone is having, first off, is based on where in the brain they're located. So are they focal or focused in just one part of the brain? Or are they generalized and they have taken over the entire brain? Then also there are unknown seizure locations, and tests of the brain are unable to tell where they're originating. But once you've sort of figured out between those two, are they focal, are they generalized, where in the brain they're happening, then you can turn and look to, is this person's awareness altered? Have they lost consciousness? Can they still talk to you during a seizure? Yes or no, it's going to lead to a different type of seizure. And then you look at different changes that have occurred, maybe in their movements, in their senses or sensations, in their behaviors, in their speech, and you add all of those together, and it can help identify what type of seizure you might be having. And it's important to try and figure out what type of seizure someone is having, because the response for each type of seizure, for helping somebody with them, is going to be different based on the different seizure type. So we're going to start by talking about focal aware seizures. So this is the first main type of seizure that we'll talk about. And these were formerly known as simple partial seizures, but the name was updated to reflect more specifically what is actually happening during the seizure. So focal, meaning it is focused in just one part of the brain, and aware, meaning that this person's awareness is unaffected. So they are still conscious, They may still be able to talk to you while it's happening and carry on a conversation as well. They may tell you, I'm having a seizure right now, when you're right in front of them. And so a focal aware seizure can show up in many different forms. So it could be a sensory seizure. So it could be a few seconds of a strange taste coming into the person's mouth, or a strange smell that only they smell. Could be a sound, maybe a buzzing or ringing in their ears, or their sight, colors may be affected, or their vision might black out or pinpoint really small too. Or it could be a motor seizure. So it could be just an extension of the person's arm that they can't control, or a rhythmic kind of tick or grasping at their clothes that they can't control. Or it could be psychological, so changes in feeling or thinking. So it could be a really strong deja vu feeling, or hallucinogenic as well. These are all very different for each person and different based on what part of the brain is being affected by the seizure. Typically, these seizures are just a few seconds to less than 2 minutes in length. And because consciousness isn't altered, really the best thing that you can do for response is to reassure this person that it's okay, whatever they need, that you can help with that, and to document that the seizure occurred. You'll see with all of the rest of these seizures, it's always very important to document when seizures occur, because that information is really important to build that history for care teams and doctors to make sure that treatments are being as effective as possible. So the next type of seizure that we'll talk about is focal impaired awareness seizures. So these are formerly known as complex partial seizures, but the new name implies focal, that it's still just happening in one part of the brain, but impaired awareness, so this person is not aware or their consciousness is altered during this seizure. So for these types of seizures, this person may exhibit repetitive or purposeless movements. They may pace around or walk around. They might just have a blank stare. They may have a change in their speech pattern. They may slur their words. They may start talking in sentences that don't make any sense. And this person may become agitated if you try and restrain them. So these are typically 1 to 3 minutes in length, so generally longer than the focal aware seizures. And they may be confused for other behaviors, like sleepwalking or like intoxication as well. So it could be hard to determine if this person is having a seizure or some other behavior. So we're going to watch a video of a man having a focal impaired awareness seizure, and then we'll talk about the response that you can have to help keep this person safe. So the response for this type of seizure is always going to depend on the individual and the situation. So when we're thinking about that video that we just watched, the first thing that you want to do is to stay calm. So then you are able to think through all of these steps and make the best decisions for you and the person who is having the seizure. You also want to track the time of the seizure, so how long it is lasting. Every person who has epilepsy and seizures should have a baseline of how long their seizures normally last and what they look like. And so if you as a responder are tracking the time, then you'll be able to know whether the seizure is lasting a normal amount of time for this person or is becoming longer than that and maybe turning into an emergency. And so if you're not tracking the time, you won't be able to really tell what is happening with this seizure. And then you don't want to restrain them too. So because awareness is impaired, this person is in a form of fight or flight mode. So if you go up to them and try to hold them, thinking that you're doing something good for this person, they may be frightened and try and push you away or fight you off, and so they could injure themselves or injure you, and you're just trying to help by being a responder. So don't restrain them. But since they can be mobile, this gentleman in the mall was moving around. If he was moving to the top of a staircase and you want to make sure that this person doesn't fall down the stairs or out into the parking lot and cars are around, the best thing to do is to gently direct them away from the hazard by coming up behind them and putting your hands on their shoulders and just gently angling them away from the hazard. And then for the rest of the seizure, try and stay in between them and this hazardous situation or place like the staircase. And then you want to stay with them until they've gained full awareness. So then you can help them with any sort of recovery that they need or document how long the seizure was, what happened, and to explain to anybody else who's around that a seizure happened and things are going to be okay and you can help with their response. So next we're going to move to generalized seizures. So generalized meaning that it takes over the entire brain. So any type of generalized seizure is always going to result in a loss of consciousness. So the first main type that we'll talk about is an absence seizure. So these are formally known as petit mal or petit mal seizures, which is French for small bad. So this type of terminology is trying to be changed to make it so someone's medical condition that they have isn't associated with a word that's a bad thing. So, but you will still come across people who use this terminology, and that's fine because that is what they are comfortable calling their seizures. But an absence seizure is brief and it's a sudden lapse of awareness. It's characterized by brief staring and or rapid facial movements, could be licking the lips or swallowing motions. Their eyes might roll back in their head for a few seconds, but after it's over, this person will quickly return to typical awareness. So they're typically only 5 to 20 seconds in length and can be confused for daydreaming or attention issues. So if you don't know that someone has absence seizures, they can be really hard to detect and you might easily miss them because they could just be a few seconds long. And if you are a teacher or working with kids and they aren't seeming like they aren't paying attention for just a few seconds long, you think that's developmentally normal. They're just a kid who's daydreaming. But some kids who have absence seizures that aren't controlled could have hundreds of these seizures throughout the day, and that can lead to development delays because their brain is shutting down and firing back up and shutting down many times throughout the day that can just hurt their development. So it's really important for people with absence seizures to find treatment so then they can have successful brain development as they're growing. So we're going to watch a video of a girl having an absence seizure, and you'll see just how quick they can be during the video.
This girl has absence seizures, and you will see her have one while she's talking.
Because he can be as heavy as ever.
And there's a real blankness, a vacant look in the eye, and then all of a sudden they're right back with you and able to engage.
So you could see how fast that was, and she just popped right back. She kind of lost her place in the conversation, but you also might have somebody who just picks up right in the middle of the sentence where they trailed off as well. It can be different for each person. So the final main type of seizure that we'll talk about today is called the generalized tonic-clonic seizure. And so this type of seizure is not the most common type of seizure, but it is the most commonly thought of seizure. So this is formerly known as the grand mal seizure, which is French for big bad. So you might still have people who call this type of seizure a grand mal seizure. But the typical progression of this seizure is a sudden cry or moan, a loss of consciousness, falling from their chair or falling to the ground. Then there's the tonic phase, which is the extended, rigid body. And then there is the clonic phase. So it's the rhythmic shaking or jerking of the body. And like we've talked about with all of these different seizures, different effects may be present in different people. So it may be loss of bladder or bowel control. It may be vomiting too. It can really be different for each person. So these seizures are typically 1 to 3 minutes in length. And afterwards, the person may feel tired, have sore muscles, they may be confused, they might have a headache. Some people might need a full day to recover from having a generalized tonic-clonic seizure. Some people might be ready to keep going right away when they get back up. It's different for each person. So we are going to watch a video of a girl having a generalized tonic-clonic seizure, and then we'll talk about the things that you can do to help respond to someone who is having this type of seizure.
They affect the whole brain and the entire body. The tonic phase is the stiffening of the muscles. Then the jerking movements begin, the clonic activity that you see here. A tonic-clonic seizure rarely lasts more than a few minutes. A person having one isn't conscious and won't remember what happened. The skin may become pale. Breathing may seem shallow or labored. Sometimes a child may lose bladder or bowel control or vomit as the seizure ends. These seizures may look painful or even life-threatening.
So let's talk about how to respond to this type of seizure. So you heard at the end of that video clip that the seizures may look painful or look life-threatening, but if this person has good responders to them and they're following these steps, it can really help keep them safe, and the seizure isn't going to become an emergency if it ends by itself. But while it's happening, here are the things that you can do to help keep this person safe and to make sure that the seizure doesn't turn into an emergency. So one, just like the focal impaired awareness seizure, you want to time it from the beginning of the seizure, so from that cry or fall down to the ground, until its end. So the end is going to be a little bit different for each seizure, but typically it's when the jerking movements stop and the person will slowly their breathing will settle, they'll come back to consciousness as well. But you want to time the seizure because then you can compare whether this seizure is a normal length for this person or if it's becoming an emergency. And it's just very important to always note how long the seizure lasts because it helps inform treatment plans. You want to turn this person on their side. You could see in the video that the girl had saliva building up in her mouth. So having them on their side helps prevent a choking hazard. It gives somewhere for that saliva to go. They may have bit their tongue too on their fall, so the blood can trickle out as well. Then you want to cushion the person's head with a pillow, a sweatshirt, a jacket, backpack. You can use your lap if you need to as well, just to make sure that their head is protected and doesn't hit the ground any more than maybe what it did when they first fell. Then you want to remove any clothing or accessories that could get in the way of breathing or cause further injury. So glasses, top buttons of shirts, ties, necklaces. If you can get them safely away from the person, then you can pull those off. And then you want to clear away furniture from around the person so they have an open area to move around and they're not at risk of hitting different pieces of furniture and getting more bumps on their body as their arms or legs are moving. And like the focal impaired awareness seizure, you don't want to try and restrain this person or hold them down because their body is trying to move by itself. So if you hold them down to prevent that movement, they may strain against that and then hurt their body even more fighting against you. And so don't hold this person down, just provide enough support on them to keep them on their side, but don't reduce any ability for this person to move freely. Then you want to stay with the person until they're fully aware. Then you can help them with their recovery, bring them to a safe place, get them up, help clean them off, anything like that. Then you can just make sure that they are safe and feeling well again after the seizure. So some reasons why you might call 911. For the most part, seizures are not emergencies if they last the appropriate amount of time for that person's normal baseline of seizure. But some reasons why it could be an emergency and you would want 911 to be called is if it is a first-time seizure. So if you don't know this person, or if it is the first time of a known person having a seizure, it could be that the seizure is just getting them on their way to an epilepsy diagnosis, or it could be because of a fever or a high infection that requires different type of medical care to help that person. So you need a doctor to help make that determination. If an injury takes place during the seizure, it's one thing if they fall down and they need a Band-Aid on their elbow, you can handle that from the site that you are. But if they were halfway down the stairs and they had a seizure and fell down the rest of the stairs and hit their head really hard or landed on their arm in a funny way, then you want 911 to be called to help with those additional injuries. If this person's breathing has stopped after the seizure has ended or the breathing doesn't return to normal, you want 911 to be called. Status epilepticus is the term for a seizure that lasts longer than 5 minutes, or there are clusters of seizures that don't allow the person to return to baseline in between them happening. So status epilepticus is something that needs powerful IV medication from a hospital to help get that seizure to stop. Some people's seizure emergencies might be shorter than 5 minutes. That would be something that their seizure action plan would say. But generally, if you don't know this person, the guideline is a seizure that lasts longer than 5 minutes. If a seizure takes place in water, you want to call 911 because any amount of water that gets in the lungs or is swallowed can be very dangerous. So you want to be in a place like a hospital that can help evaluate that and monitor things if you take a turn for the worse. Other health conditions would be a pregnant woman to make sure the baby is okay after the seizure, or someone with diabetes to make sure that blood sugar is still stable after the seizure. And then finally, if you feel like you can't respond appropriately to the seizure, there's no shame in calling in experts who are trained to help and handle these types of situations. So we talked earlier about how it is rare to die from a seizure. It is possible though. So one cause of death from epilepsy is called SUDEP, sudden unexpected death in epilepsy. And so generally it is when someone who has epilepsy has passed away and there is an absence of some other cause that happened to make them pass away. So this affects about 1 in 1,000 people who live with epilepsy, and those risks are higher with people who have uncontrolled seizures, people who have had epilepsy since they were young children, so they've had epilepsy for a long time. It generally increases in risk for young adults, 20 to 40 years old. Those with nocturnal seizures at night have a higher chance of having SUDEP, and then those who aren't taking medications regularly as prescribed, so they don't have good medical or medication adherence, can result in SUDEP or those deaths from epilepsy. So it can happen. It is rare, but it can happen. So the different treatment options for epilepsy are varied, as opposed to some other medical conditions where you're diagnosed and there is one or two treatments that they start you on right away. Epilepsy has a lot of different options that are going to work for some people very well and other people not well at all, and some people right in the middle, so they might use multiple treatment options. So we're going to talk about medications, brain surgery, implanted devices, diet, and medical cannabis as treatment options for epilepsy. So first, we'll talk about medications. Medicine is the primary way in which seizures are controlled, and it is almost always the first therapy that is tried for controlling somebody's newly diagnosed epilepsy. So medicine can control seizures for about 7 out of 10 people living with epilepsy, but the important thing to note is that there are a lot of different types of medicines that help with different kinds of epilepsy or different kinds of seizures, and some people might just take one medication, some people might take a couple of different types as well to help control their epilepsy. And the biggest thing with medications is to never stop or change them without talking to your doctor first. That should always be a decision that runs through your care team about medications. And even if you decide with your doctor that you're going to stop one medication and start another, you need to gradually come off of one seizure by reducing its dose, or seizure medication by reducing its dose, and starting up another one very slowly as well. So that ramp up and ramp down periods are important for changing medications. So the medication effectiveness, 47% of patients find control with their first medication they try, 13% find control with their second medication, and only 1% of patients will find control with their third or fourth and beyond medication. So these numbers are really just to show that if you don't find control early with medication, your type of epilepsy might be a little bit harder to control, and you might be in that about 30% of people where medication isn't going to be an effective option for your epilepsy. And side effects will vary based on medication and the individual, but side effects could be different ends of spectrums of high activity or lethargy, could be weight gain or weight loss, could be issues with your cognition, so memory or speech could be affected as well. These side effects are very different for different medications, and they might just be present right when you're starting on a medication, but it could just be something that a trade-off that you need to make to have control over your seizures with a certain medication. You might live with a side effect too because it helps prevent seizures. So in addition to everyday use medications, there are also emergency medications that can be prescribed for people living with epilepsy that would be used for seizure clusters or when seizures are more frequent, longer, or severe than typical. So these are taken as needed to prevent a seizure emergency from occurring, and the phrase seizure emergency is going to be different for each person, but they are not used as daily medications, and they're available in different forms too. So they can be administered rectally, buccally in the cheek, or nasally as well in a sort of spray. So the ideal emergency medication is going to be easy to use. It needs to work quickly and get a lot of medication in the body really fast to help stop these seizures from occurring longer than what they're supposed to. And it needs to be safe with little or no side effects. And it needs to be in a form that meets the person's needs, so the individual's needs. It's not a one size medication fits all. It's going to be different for each case. And it obviously needs to work well. But emergency medications, if all goes well with treatment and other forms of treatment, then they shouldn't need to be used, but they are there as a safety net to help with any emergencies that might occur. So brain surgery is an option for individuals who maybe aren't finding good control over their seizures with medication, or their care teams, their neurologist or epileptologist, who is a neurologist but has specialty in epilepsy, have determined that there is a part of the brain that could be either removed or separated to help control seizures. So candidates might be those who have failed other treatments or are not finding good control with other medications or diet or other therapies. Or it could be if the seizures are becoming so uncontrolled that it increases the person's risk for harm or physical injury, accidental death, or SUDEP as well. So the care team can look at it, and if they think that this person is a good candidate for brain surgery, then it could be an effective treatment for this person. So recovering from brain surgery, most people are back to school or work in a month or maybe a little bit longer. It could result in changes in the person's thinking ability, their memory, their social activities or emotions may take longer, depending on the individual as well. They are usually stay on medication for several months after the surgery to determine whether the surgery was effective or not, or maybe they'll still need that extra support from the medication. But many people who have successful surgeries can achieve new milestones in seizure control. Some people might never have another seizure again after a successful brain surgery, but some people might also consider their surgery a success if their seizures aren't as severe when they happen, or they are shorter, or they have less of them during the day. So it can be really different for each person, but brain surgery can be a good option for the right candidates. Implanted devices can be an option for seizure control as well. So these still involve surgery and implanting these medical devices. They generally all can be thought of as a pacemaker, but for the brain. So the different forms act in a different way based on the type of seizures the person is having or what part of the brain they're coming from. But they send kind of regulating electrical stimulation to the brain to help shorten a seizure that's happening or to lessen its severity. So the vagus nerve stimulator has a device that you place in the chest, and it connects to the vagus nerve in the neck, and that sends stimulation up to the brain to help in this form. The responsive neurostimulation, RNS, records the seizure activity daily and delivers stimulation by itself to try and stop seizures once it recognizes they're happening. Then the deep brain stimulation, the DBS, also has a stimulation device in the chest, but the electrodes go up into the brain close to where the seizures are occurring to try and stop those seizures from happening when they start. And so all of these devices, some are going to work for some people and some won't. So the care team would help decide whether this could be a likely option. But most of these allow people to have better seizure control that actually increases over time as the brain receives more of this stimulation. It can help with the brain chemistry and regulating electrical activity. And now diets can be a successful treatment for some people's epilepsy as well. And so ketogenic diet, I'm sure everyone is familiar with the keto diet as a fad diet currently, but this was actually developed almost 100 years ago, specifically for epilepsy treatment. And so you can see the standard American diet is about 60% carbs and 25% fats. The keto diet will flip that very severely and will shoot for about 90% fats and 2 to 4% carbs. So it is an extremely high fat, low protein, low carb diet. It's looking to get the body into ketosis, which through different forms, it's not exactly clear why, will help with brain chemistry and can help reduce seizure activity. And so this diet limits fluids. To start it, typically you start fasting before starting this diet, and it has really strict guidelines about the food that you can eat, and each meal you are weighing out to the gram whatever food you are giving to the person who's having the diet or what you are eating. So it's very strict. You need to weigh everything. It's an entire lifestyle change, but it can be really effective for some people in reducing their seizures. So some other diets that can be prescribed is the modified Atkins diet or the low glycemic index. And so you can see that they are just a little easier to maintain because it allows higher fats or maybe a little more carbs as well. And so the modified Atkins diet is easier to maintain than the keto diet, and the low glycemic index is even easier, and it allows more flexible meal options, and it's based more on portion sizes rather than weight to the gram of each food too. So the care team can help determine what strength of diet somebody might need or that would be most effective for them, but there are different options that exist. And lastly, medical cannabis has proven to be effective for some people living with epilepsy to help control their seizures. And the way the medical cannabis program works in Minnesota is a patient has to have a qualifying condition, which epilepsy does qualify. They need to have some healthcare practitioner certify the condition. Then the patient will register with the program, and then once they are approved, or if they are approved, then they can obtain the cannabis from a patient center that is spread out throughout Minnesota. And so in Minnesota, the forms that exist for medical cannabis are pill form, liquid form, or oil. So there's no smoke and no plants involved. But through these different forms, it can be an effective treatment for those living with epilepsy. So some additional impacts of epilepsy. It's very important to discuss not just the treatment of epilepsy with your doctor or how to affect these few minutes of every day that a seizure is happening, but look at the entire picture, the whole person, and how their life is impacted by epilepsy. There are a lot of challenges, and how they all interact together can prove very difficult. So there can be emotional, social, and psychological effects. It will definitely affect finances, your insurance, and your health care. And it can also isolate someone who lives with epilepsy. It'll can affect where they can work, how they can drive. And so all of those combined can make it very difficult to live with epilepsy. So people who live with epilepsy and their families and caregivers might face stigma of living with epilepsy. They might face discrimination. Having epilepsy and seizures can create a lot of unpredictability in your life, that a seizure can happen at any time. So that can lead to fear, loss of independence as well, that you're always waiting for this next seizure to occur and not feel like you have a lot of control in your life. So a really important thing for those living with epilepsy is that independence and finding employment and ways to live a successful life. And so areas to manage the impact of epilepsy with employment are: one, finding a job in the first place, whether you need to disclose that you have epilepsy to an employer. You don't need to disclose it to an employer, but it can always be a good thing too, because then the people around you will know about it and you can educate them how to best keep you safe during a seizure. You need to think about medical questions, how you might answer those questions or educate those around you. Make sure that the job that you have is safe for you to be doing it. And then consider, if you are changing jobs, to kind of think through all of these questions again to make sure that it's going to be a good fit for you. The simple ways that employers can help support employees with seizures is to provide reasonable accommodations for them. We'll talk about more of those in a few slides. You can educate other staff members and coworkers so the entire workplace is more prepared for a seizure if it happens. Make sure that processes are accessible and able to fit into the abilities of this person who does live with epilepsy, and provide clear and direct communication around work tasks and then expectations as well. So the Americans with Disabilities Act is a federal law that prohibits discrimination against qualified individuals with disabilities, and epilepsy is considered a disability and covered under Title I of the ADA. So this requires employers to provide reasonable accommodations for employees who disclose that they have epilepsy. So the ADA applies to employers of 15 or more people. And so let's look at some reasonable accommodations. And I think you'll notice that these aren't as unreasonable as maybe what you thought of before. So the goal is really to reduce any seizure triggers that might be present in the workplace and to increase safety for this person. So that could be just scheduling more breaks during maybe a period of time that that person knows they're susceptible to seizures. It could be writing down instructions or tasks if this person has memory difficulties because of medications that they're taking or a brain surgery that they had. It could be an anti-glare computer screen or helping with how long they are actually needing to look at a computer screen. You might adjust their work schedule to fit maybe their home life more. So maybe it might mean pushing their work hours later into the day so they can make sure that they get enough sleep in the mornings. Maybe you give them permission to work from home certain days if they've just had a seizure the day before and they need to work from home the next day. That can be an accommodation for them. Or help set up carpools for them to work meetings, or provide information about bus routes or public transportation to get to work as well, because maybe this person isn't able to drive by themselves. So some different epilepsy resources that we want to make sure people are thinking about is a seizure action plan. And so these plans should be filled out for anybody who has epilepsy and seizures, because it provides really important information for people around them for what to do if they have a seizure. So it will tell you what their seizures normally look like, how long they normally last, who to call in the event of a seizure, or what to do. And so make sure that these action plans travel with the person. So if it is a student, make sure it is lodged with the school nurse and their teachers. If it is an employee, make sure that the employer has it or people around them know what to do to help as well. The SUDEP Institute provides really important resources about the risks of SUDEP and preventing premature death for those who live with epilepsy. And then different tracking devices. So there are seizure alert devices or wearable technology, sort of like watches, that you can get to help track seizures, that can alert caregivers that seizures are occurring maybe in the next room overnight or things like that, and they can help provide response. Seizure tracking journals or devices to just mark down when you're having seizures, how long they lasted, and characteristics, so then you can give that to your care team. And then medicine reminder apps can be really important too, because it's so important to always have that medication at the right level in your blood. Then the medicine reminder apps can always just keep you on schedule so you don't forget, and keep you as safe as possible with the medicine you're taking. So the Epilepsy Foundation of Minnesota wants to help however we can to anybody who has epilepsy or cares for someone who has epilepsy. Um, so one of those things is our information services, which is free one-on-one support. We can provide customized tools and resources for epilepsy questions, any sort of topics, so about employment, about alert devices, about seizure types, what doctors might be best for them, etc. All those things can be helped work through with information services. And we can just provide materials at someone's request because they maybe want to share them with other people in their lives. And so Debbie Leone is our senior coordinator of information services, and you can see her contact information on the screen there if this is something that you want to take advantage of. So the Epilepsy Foundation of Minnesota's mission is to fight to overcome the challenges of living with epilepsy, to accelerate therapies to stop seizures, find cures, and save lives. So this training is an important step in spreading awareness about epilepsy and seizures. It can help save lives and keep people safe as well. So we really thank you for watching this training today. If you have any questions about any of the information here, please feel free to contact me at my email address. I'm the Metro Program Coordinator. And the ways that you can help make a difference, we do have an evaluation for how this training went, and please fill that out if you have the time. And then if you want to give a gift, you can at this site. Epilepsy Foundation of Minnesota also provides donated good pickups as well. So if you have used old clothes that you're not going to wear anymore, you can set up a pickup for those items, and the Epilepsy Foundation has dealers that we sell that to, so we get a portion of those sales that we're able to pour right back into our mission of helping those who live with epilepsy. Any of that information can be found on our website as well. So thank you once again for watching our training today, and please feel free to always reach out for any questions that you have. But thank you so much again, and have a great rest of your day.